Daphene. I'm a personal assistant to the corporate nursing team here at Bedford Hospital. So I've only been in the role for, this will be my 11th week in the role, so I'm very new to the role. So my role is to look after the Associate Director of Nursing. Well, there's two, so I look after both their diaries, plan their meetings, attend the meetings, minute the meetings, and just generally oversee what they have in their diaries every day, ensuring they get to where they should be, and just answering general queries around their day or their tasks, setting up venues for events on their behalf. So it's kind of a bit of an organising role. Prior to my role I'm in now, I worked in critical care. I started working for the NHS in 2004, so this is my 17th year working at Bedford Hospital. So for 17 years I worked in critical care. I started off as a clinical support worker, which I loved. I did that role for 9 years, and because of my home life it was very difficult to continue with the nights and the weekend shift patterns, so I had to look at an alternative, and I was offered the data administrator role, still on critical care. So I went into that role, and at first it was a challenge because I really missed the direct patient contact and the clinical side of my previous role. However, I still felt I made a difference to the patients with the role I was doing, and I also was based on the unit, so I still got to see the patients, I still greeted their visitors, so still had a bit of a hands-on approach. So I did that role, obviously, for the remaining 8 years. And then I felt I needed a change, a new challenge. I feel I'd kind of come to the end of my kind of career with critical care. So yes, I was offered this role and I took it, and I'm really enjoying it. Well, for the CSW, the clinical support worker, when I first came, I didn't need any formal qualifications. It's probably changed a lot since then, but I didn't need any. It was more about you as a person. But I do know, whilst I was doing that role, I did do a MVQ, health and social care, which just kind of aided me a little bit into the role I was doing. For this role, again, you need a sort of an administrative background, good keyboard skills, good sort of Office, Microsoft knowledge, Excel, managing diaries, calendars, that sort of thing. Being able to be quite computer literate in the role I'm in now, I think is one of the qualifications. So any kind of electronic office skills would be useful. I think you also need to be good at organising, so good organisational skills, because you are in effect organising people's day-to-day diaries. So it's down to you to ensure they are doing what they should be doing and where they should be doing it. You also need to be a good communicator, because you are communicating for a lot of the day with a lot of stakeholders, externally and internally within the trust. So communication is a very big part of my role. So you would need English, maths. Well, I would really promote the NHS, this organisation, any organisation within the NHS, because you have got lots of excellent benefits. You've got a good pension. The pay is good in comparison to other admin roles I've seen outside of the NHS. You're very supported, encouraged to develop your skills as well, so you can take it further. They offer you courses, so you don't have to stop and stay where you are. You can develop within your role and move on to other roles, so there's lots of opportunity within the organisation to move and to develop. So that to me is a massive bonus and a plus. You're also very supported. It's a very friendly place to work, and administration might seem boring, but it actually isn't. No 2 days are the same. So it is very challenging and it is pressured, but it is never boring. So it's quite exciting, and it's rewarding, and you feel like you are making a difference.